This podcast is about storytelling. I am your host, Dr. Mijiza Sanchez-Guzman, Associate Dean of the Office of Medical Student Affairs and the founder of the First Generation Mentorship Program at Stanford Medicine, and I am proud to be first generation. Many of us are the first in our families to accomplish living the dream. Being the first means different things to different people. Join me now on a journey as we share our stories about how we've navigated being first generation in academic medicine. I will have the honor and pleasure of interviewing first generation clinicians, leaders, mentors, students, faculty, and researchers as they share their lived experiences of being the first. I hope these stories will inspire the next generation of leaders in health sciences. Today, I have the pleasure of speaking with Dr. Mike Gisondi. Dr. Gisondi is the inaugural Vice Chair of Education in the Department of Emergency Medicine and Assistant Dean for Academic Advising at the Stanford School of Medicine. He is the principal and founder of the Precision Education and Assessment Research Lab, the PEARL, and a distinguished member of the Stanford Medicine Teaching and Mentoring Academy. Dr. Gisondi is a medical education researcher and an expert in the application of social media in medical education. He is a member of the editorial boards of Academic Life in Emergency Medicine and International Clinician Educators blog, and he is the associate editor of the textbook Emergency Medicine. Welcome, Dr. Gisondi. We're so happy to have you here today.
Well, thanks so much for having me. That was much too long of an introduction. I hope people are still tuned in after that.
Could you share a bit about your background and what led you to the field of academic medicine?
Sure. It's not that glamorous of a story. If we're on a first gen podcast, I probably should just preface by defining what first gen identity I do have, because I think it's relevant to my background. But there's all sorts of definitions of first gen. I'm going to embrace the one of first gen to college, or to certainly to graduate school. My folks were a fireman father and an emergency room nurse. And if you didn't know, when they get together, they make emergency physicians. That's what happens. And I was the only in my family in upstate New York. And I had an uncle, kind of a remote uncle, who's a lawyer. And I looked up to him because he was really the only person I knew in my extended family who went to college. And, I kind of winged it, sort of going through school. When I was young, my dad used to work every fourth day. So he'd be off for 72 hours, on for 24. And my mom worked the 3 to 11 in the ED. So when I was a kid, I stayed in the emergency room in the nurses' lounge, every fourth weeknight. And, I was 8, 10 years old, and it was a little community hospital, and there were no HIPAA rules back then. So the docs would get the 10-year-old boy to come out and look at whatever was gross and cool in the emergency department. And that was my introduction to medicine. And I didn't know about other professions. I didn't have a sense of what lawyers did or what politicians did. I certainly didn't know how to define engineering. I got into an engineering school for college. I actually couldn't define what an engineer was. So I just kept thinking I'm going to be a doctor, because that's really all I knew. And it was sort of cliche, right? So I went through pre-med, and I went through medical school, and sort of went straight through with no gap years, because I didn't know what I would do if I took a gap year off. I really had no idea. And early in college, I worked in a virology lab with bacteriophage. If you don't know what that is, it's this mythical thing that can carry viruses, and I hated it. I just pipetted clear water all day long, and I just, that was my introduction to research. So I thought, for sure, I'm not going to do academic medicine. There's no way. And when I came to apply to emergency medicine for residency, which we can also get into, I think it's very cliche and was sort of silly at the time that I was going to follow my mom's footsteps in ways that I hadn't anticipated. But I came to Stanford for my interview. And I remember telling one of the program directors that I would never do research, and that if they took me, I would be the best clinician they ever had in the residency. And in retrospect, I have no idea why they matched me, right? I came to research institution. I was like, I hate research. It's terrible. And now I run a research lab with collaborators that have millions of dollars of grants, and it's sort of crazy. But that's what Stanford did for me. It offered me this window into academic medicine I had no exposure to. Even in medical school, I didn't go to a big research powerhouse medical school. I went to a small college, and it really wasn't until I got here that academic medicine became an option. It certainly wasn't something that I was exposed to at any point. In my earlier training or young development.
Thank you for sharing. What are some of the barriers or challenges you faced as you pursued your career and or education in medicine?
Yeah, I mean, there are several. I reference going to a small college. I went to Catholic University in DC, so a small Catholic college. And I went there because this godfather uncle of mine that I mentioned had gone there for law school, and we knew that there was a family of alumni scholarship. I think it was all of $1,000, honestly. And that's why I applied to the school, because wherever I was going to go was going to be where they gave me the most scholarship money. So I got into some bigger name schools, and I think barrier number one was that my parents really wanted me to leave college with no loans if I could, and uh, they they were a working middle class family, and it was really all about scholarship money. And I remember actually at the end of my first year of college, I was told I couldn't go back unless I became an RA, because I needed to pay for my room and board. Otherwise, I was going to go back to a state school in New York. And in retrospect, probably the first instance is that I mean we were very financially sound middle class family without debt, and the idea of debt and how I might pay back debt was completely foreign. And no one ever sat me down and said, well, you can go to the bigger name college if you want, because someday you'll just pay it off and you'll work, and that's how it works. And not to make little of student debt, it's a huge national crisis, but it wasn't even an option on the table, right? So
Hmm.
I go to this small Catholic college, and I mean I didn't have the easiest time getting into medical school. I got in on the first round, but to a handful of schools, and not again, not your Stanfords of the world. I don't think they would have taken me. And it had ramifications. Now I think things all turned out swell. We're here on a vlog at Stanford, at my happiest place on earth, but it was a circuitous path, right, to get there. And I think if I reflect on academic medicine, I had no clue what that was, even having grown up in an emergency department with these physicians that worked closely with my mom. And I mean, we're talking a small community hospital. Like, they came over for Fourth of July picnic. Like, we were a pretty close department, this small department. And none of them had trained at big academic medical centers. And so I didn't really have that introduction. I didn't have that explained to me. So I got to medical school and felt very lucky. I used to do this thing where I tell students this all the time. When you're stressed out in medical school, it seems very horrible, and it's working really hard. You have to rub your seat, right? Rub the handles of your chair, because there's so many other kids that would rather be there than you, and you're so lucky that you're there at all, right? And this was reality for me, because I would look around, and I would say half my medical school class certainly had professionals as parents, and I would say the majority of that half had physician parents, and they just made it look easy. They knew what was coming. They got to the wards, and they just had a different socialization than I had, and I was just so nervous. I mean, the imposter syndrome was palpable in the room. And if I just stood weird, or I said something odd, or any of that, it was just overwhelming. So I think those two instances, right? And it's the sort of preparation for college and what it could be, and how you socialize yourself in a medical center, despite having grown up in a hospital, right? Despite a somewhat medical background, was just foreign. And I mean, that puts you behind the eight ball a little bit, right? You have to play catch up, and you have to do so with a little tougher skin, and a lot of worry and anxiety and self-consciousness. Those are the outcomes really of those experiences.
Yeah, thank you for sharing. As you were talking, I was reflecting that that's also how I chose my undergrad when I was in New York and trying to figure out where I was going to go to school was because they gave me the most money. I think
So I
that's a
picked.
common story.
Yeah.
What do you wish you knew before entering the world of academic medicine as a first generation professional?
Wish I knew it was fun. Like I think academic medicine is so fun. And I didn't understand that really until I was a trainee at Stanford. I had no idea. I mean, my introduction to that virology lab as a first year in college, I mean, I don't even really know if I knew what research was. And I had a research mentor who was very kind, but I mean, he didn't have a lot of time for a freshman, and he just had me pipetting things and writing numbers down and autoclaving stuff, and I'm not even sure I knew what we were trying to questions we were trying to answer. I mean, it was so foreign, and I was just doing what I was told, not really thinking, right? And then
Mm,
in medical school, I went to Loyola and in Chicago, and it's a wonderful medical school. They treat their students so well. There's certainly research that happens there, but they pride themselves on having a student learn how to use their stethoscope, right? Like it's a clinical medicine kind of a place that you walk out, I think, clinically very, very well prepared, but perhaps not for research. And again, that sort of led to my ridiculous answer in my residency interview when I came to Stanford, which I'll even say was a whim that I applied. Uh, I did well in medical school and I had options, and I thought, well, this is really my only chance to just go around the country and interview at these big schools that were never really an option for me before. So, I went coast to coast. I was single. I had nothing holding me down. So I just picked all the big name schools, and I maybe even Stanford was the first time I thought about Stanford was for residency. If you'd asked teenager Michael in upstate New York in some small town, I bet I wouldn't have known that Stanford existed, honestly. So, this was my opportunity to go to sort of go coast to coast. And at the time, emergency medicine was still quite young. It's the youngest specialty. And it was very young at Stanford. When I interviewed, they had only had 4 graduating classes at that point.
hmm.
And I'd been sent out to the West Coast with a certain set of programs to look at. My advisor told me these are the best programs, and I was discouraged to apply to Stanford. They're like, it's too new, and you should go to these established programs. And I went to those programs and up and down the West Coast, and I didn't like any of them. And it was the end of my interview trail. I'd interviewed at far too many places, and had done the East Coast and Midwest already, and I sort of felt like I had some programs out there that would be appropriate. And Stanford was my last interview, but it was within 14 days of the interview that I was out there that I was like, oh, maybe I should cancel. I'm like, I can't cancel. I'm a good little Catholic kid. I'll have guilt. Right. So you have to go. Right. So I went to Stanford and I just loved it. I fell in love with this place on interview day, despite all my advisors in Chicago telling me I was insane for going. And I don't know, it's the people really made it. The department was a lovely place, and the folks running it were lovely human beings, and I don't know, I trusted them. So I came here, and all of a sudden, academic medicine was all around me. Right, I was at this world class research institution where everything is about research, and it had never been for me before. Right, and again, I didn't know professionals. I didn't know even how research and how fields were advanced. I mean, I was read research papers in medical school. I'm not saying I was blind to it. I just didn't think I would enjoy it, right? But I got here and it was fun. They let residents ask questions that they were interested in, and there were people to help them answer those questions. It blew my mind. We had grant writers and editors and faculty who would mentor you, and you just had to ask a question, and it just got so exciting to do that. And I owe my whole career to having trained here. I mean, I guess I worked here, I left, I came back, et cetera. But we could get into that. But really, I just didn't know that that academic medicine would be as enjoyable as it is. And it was the role modeling and the mentorship that I got when I was, very junior in my career, during my training, frankly, that opened the door, because certainly I hadn't had that, um, you know, made made an option any other point along my training, along my education.
What advice would you give to someone interested in pursuing a career in academic medicine?
Um, you know, I think you have to enjoy, a few different parts of it. So it's a medical school. You have to teach medical students. You have to enjoy teaching. Um, and I think we think of academic medicine as perhaps the research mission of schools, but really it's a school. So there's a teaching mission first. In my field, it's interesting. We'll watch residents sort of progress through residency, and they get to be a senior resident, and now they're teaching junior residents. And I the ones rising up will say, I do want to do academics, and I don't want to do academics. So you have to wait until you teach someone something, and particularly a procedure in my specialty, right? So if you're watching someone put a central venous catheter in someone's neck, and they're holding the needle, and you know how to do it, but they don't know how to do it, and they don't know how to do it, and you're watching them, and you're just like, give me that needle. Oh my God, I can't. Then you're not settled in academic medicine. Like, you're not going to be able to, excuse me, be able to hack it. So you have to be able to have a little bit of, um, ability to do those sorts of things, to be able to enjoy the job at all. And I've certainly seen folks in academics over the years that they didn't embrace the teaching part, and they were kind of unhappy overall, right? They were in it for the wrong reasons.
Mm-hmm.
There's a lot of ways to be an academic that don't involve, research. I'm sorry to tell everyone here at Stanford that that's reality, but it's true. You don't have to do research, but you can still be scholarly in many ways. But obviously, um, how you ask questions and answer questions and disseminate knowledge, those are important communication skills to have. You have to enjoy that. And that was a tough skill to learn. I mean, I wasn't born a scientific writer, right? It took many, many years before I felt like I cracked the code and learned how to write a journal article, and could, to turn them out quickly. It
Mm-hmm.
took many, many years of being a junior faculty to learn how to do that. And some folks, that's the exit for them. They just don't enjoy writing, or
Mm-hmm.
perhaps they don't enjoy speaking, public speaking. And those things are sort of requisites, perhaps. So you've got to be able to play in one of those lanes to be in academics. Um, but it comes back to teaching. You've got to enjoy pursuit of knowledge, watching students' eyes light up when they see their first insert procedure, right? Any of those things have to be exciting to you. And I think there's a group of physicians out there in working in our community hospitals, which are the majority of the 4,000 hospitals, or community hospitals, non-teaching, that keep the American healthcare system moving. And they're very, very fulfilled and pleased and happy. And then there's those of us that if we were out there alone, it would be alone. It would be lonely. I worked a little bit in a community hospital, just a little bit, after finishing residency, kind of a part-time gig. And I would make a diagnosis, and then I would look around and tell people, like, how cool is this? We're seeing X. And like, no one cared. The nurses didn't care. They were like, all right. And there's no other doctors. I was like, this is so lonely. I got to tell somebody I just saw this really cool thing. So anyway, academics kind of fell in my lap that way. And so anyway, I would say, if I'm giving advice to answer your question more directly, it's, you got to have certain skill sets. You got to try them out and make sure that it's right for you. You can't just say on day one of arriving to medical school, I don't care which medical school, ours as well, that I'm definitely going to do academic medicine. It's an exploration of who
Mm-hmm.
you are and your identity, and a kind of, something that you become, I think, as an academic.
Mm-hmm. Mm-hmm. And speaking of your identity, how do you think being first gen has shaped how you've approached your professional career?
Um, I like to think that, I don't know. I mean, I like to think I give everybody a fair shake, maybe, and I don't know that was always the case for me coming along, and it's due unto others, right? So I had some uncomfortable moments throughout, medical school, and in particular, um and I try not to forget that. distance traveled means a lot to me when I'm meeting a student or a resident. Um, and we have some very bright folks here with very fancy pedigrees that are far better than the pedigree I came to Stanford with. And still, those folks can travel very different distances if they're first gen. So, um, it sometimes is irrelevant what schools are listed on their CV. They have the very same experiences that I had at my schools in many ways, and I try not to forget that.
Mm-hmm. Do you believe your first generation status influenced your career choices and trajectory? And if so, what ways?
Oh, absolutely. Right. So, I told the story of little Michael in the nurses lounge, right? So when I went to college and I was pre-med, I just thought, well, I don't know what else to do. So I'll do medicine. And I got lucky that I got in really at all. And then I got to medical school and I thought, well, I can't do emergency medicine, but I really liked imagining myself working in a role that like um, cared for a community. And in college, Catholics in DC, I worked at the Whitman Walker Clinic, which is a gay and lesbian health clinic, which at the time really was just focused on HIV/AIDS. And this is, around 1991, 92, when we didn't have the drugs that we have today and folks were dying of AIDS. And I remember working in the clinic, I was in their marketing office, and we used to make billboards that would go in bus windows and things that talked about condom use and safer sex and things. And um, my manager died of AIDS while I was there. It was really um, an important time for me. So I thought I'm going to do HIV medicine. Right. This is the way I'm going to sort of connect to a community. And I went to Chicago for medical school, and while I was there, the protease inhibitors were developed, and all of a sudden, we looked at HIV differently, and it was going to be a chronic disease and not a death sentence. And my plans to do infectious disease kind of changed a little bit. I did my third year clerkship on internal medicine, and with all due respect to internal medicine, I was a little bored by sort of chronic disease. To be honest, it just wasn't going to be my jam. Diabetes and hypertension. And, oh my gosh, every single week I would have been tough for me. So apologies to my internist colleagues. You're wonderful. But so this was a crisis now, because I thought, well, the thing that I'm going to always do is perhaps not going to be the kind of practice environment that I'm going to enjoy the most. So I had um, as type A medical students do, I had a complete meltdown in third year of medical school. I thought, well, I don't know what I'm going to be. So I just started shadowing around the hospital. And I came to realize that the emergency department, despite all my best efforts at avoiding cliche, they were my people. My dad was first responder. If you're going to pick the first responders in a hospital, it's the emergency physicians, right? We are mandated by federal law to see anybody at any time, no matter their ability to pay 24 hours a day, 365 days a year. No other doctors mandated in that way. And there's a first responderness to that. And it's kind of a different vibe in the ED than it is elsewhere in the hospital. And that landed well for me at the time. But I explored some others, and I'll tell you this one story which relates more to your question, and that's what I'm getting to. I was sort of down between anesthesia and emergency medicine. I really like anesthesia, and I think I would have very much enjoyed being an anesthesiologist. But this one sort of culture moment is what made me decide to stick with emergency medicine. I rotated in anesthesia at a very well-to-do community hospital in the suburbs of Chicago. It's a very, very nice hospital. And I was the only student there doing this clerkship. And I remember I was in the physician's lounge for the anesthesiologists between cases. And, um, they were all white, and they were all older. So sort of old white men room, and they were in their scrubs, and they were reading the newspaper, and they were talking about their stocks. And it's just such a silly story, because this is not how I think anesthesiologists behave. But that day, they all were talking about their stocks, and one of them said, without like taking the paper down, hey, Mike, what stocks do you have? I'll tell you how they did that today. And then, like, Dr. So-and-so, I don't have any stock, 20, 23, 24. And he said, all right, well, what ones does your dad have? I'll just tell you those did. And my father actually had stock. I told him the story later. I didn't know that he had any, but I'm like, my dad's a fireman we don't have stocks. And I just all of a sudden felt really different. I mean, who knows how many of the anesthesiologists were first gen and, had similar experiences, but at that moment, like I was definitely this kid from a middle class household that lived very different life to that point. And I thought, how excluded do I feel right now? This is terrible. And again, it has nothing to do with the practice of anesthesia, and my anesthesiologist friends don't act like this, but that day it just felt different, and it reinforced that I really loved being in the emergency department with a whole host of different Americans from all host of different backgrounds, and I was sort of meant to be there. So that had a profound impact on my specialty choice. Was my first gen status profound
Mm-hmm.
because of those experiences. And
Mm-hmm.
I wonder now if I had a different clerkship at an academic hospital instead of this community, where would I be today? That day was that formative. I probably should never have let it be that formative, but that's sort of the mindset, right? You come in
Mm-hmm.
as this, I mean, I hate to say like the first gen kid who doesn't know any better, but I kind of didn't know any better. And I thought, well, this is what I'm just extrapolating this to this anesthesiologist. Am I ever going to fit in? I don't think I can
Mm-hmm.
fit in this world.
Right.
So here I am, the emergency physician. Yeah.
How do you believe we can make the field of academic medicine more inclusive and accessible to first generation professionals?
Well, I think that there are a number of great examples of important pipeline programs out there that make available the time and mentorship of faculty, particularly in research labs and otherwise shadowing experiences and subspecialty clinics or procedural based hospital specialties, places that a first gen kid just couldn't get to easily, right? Maybe they can get to their pediatrician's office and like look around a little bit, but like we have to give them access to other parts of the hospital and the academic medical center that they might not see. And there's some great pipeline programs around the country that do that. Um, we had some ability in admissions world just until a couple of years ago where we could intentionally diversify our classes in a host
Mm-hmm.
of different ways. And first gen is just one identity that could be considered. And I think having diverse medical school classes make for better doctors. It better reflects the American population that we care for. We in healthcare do not look like the patients that we care for, top to bottom. And there was a lot of importance to the way that we selected students. That's my experience and my observations. And now we're in this anti-DEI environment as if it's this dirty word, and we're going to lose something as a society because of that. I'm
Mm-hmm.
glad I live in a bright blue state and a bright blue part of a bright blue state at a school that still values um, DEI initiatives and will embrace these pipeline programs and continue to make them available to students to allow them to imagine themselves in a different role. I have a colleague in my emergency in the emergency department, Dr. Jennifer Newberry, who's really interested in imagination and what it does for folks who are in situations where perhaps they just simply couldn't imagine themselves in a different context. Let's take the patient who's suffering from intimate partner violence, maybe just simply can't imagine themselves being in a different relationship. Like they're unable to visualize it, right? I think that exists for first gen kids too. They just may not be able to imagine themselves in this role, as a high school student from a low
Mm-hmm.
income family, perhaps, or or their first gen identity is different than mine. They're first gen American kids with non-English speaking parents, and they're
Hmm.
working two jobs. And these are the realities of first gen experiences, right? In different
Yeah.
households. And all of a sudden, you have a crisp white coat on a researcher who's on a vlog or whatever. And how can they imagine themselves in that same spot? Some certainly can, they certainly can, but many can't, and we have to be able to show it to people for them to be able to see themselves in that seat. They can't otherwise understand what research is, right? Or what a research, right? The same things that I couldn't appreciate. I just didn't know what they looked like. So I think that's the most important thing, is providing access early in in ways that allow people to explore careers and imagine themselves um, in authentic ways.
Yeah. Can you share any mentors or relationships that have been particularly influential in your career?
Yeah, I think you only carry a few mentors with you in life. Like we have lots of advisors, and assigned mentors, and things. When you really think about mentorship, I view mentors as folks who perhaps were assigned a role to you at the beginning as an advisor, but your relationship with them transcends that time limited assignment, um, in often profound ways, many many years later. And I was just in DC 2 weeks ago, and I contacted my pre-med advisor. Her name's Marion Fickey. She's been the pre-med advisor at Catholic for 40 years. And I mean, I'm out of college 30 something years. And so I'm a part of her earlier cohort. But we've kept in touch mostly because I've thanked her a million times along the way. She got me into med school. And I even remember the first time I spoke with her on the phone. I was wringing my hands about these other bigger name schools that will remain unnamed. And she had a role in the scholarships I got, and assured me I would be okay there. It took care of me, and and it allowed me to have the life I have now. She got me in, and because of that, I've been incredibly grateful. I mean, at every point along the way, I've thanked her. The day I got into Stanford, the day I got my first job at Northwestern, the day I got to come back to Stanford. I mean, all the things, every title I've gotten along the way, she gets an email, and I've never forgotten her. And she put her advising hat on in the context of who I was and where I was coming from, and um, helped me, envision myself, moving forward. Another important person was my med school advisor, Jamie Collings, who was an emergency physician at a school when emergency medicine, again, was very young. She was one of two emergency physicians in the whole hospital, and was bound and determined to get me, into this specialty, and into a great program. Um, and always remained, such an important person at a distance, where I could call her and say, well, these crazy jokers at Stanford want me to do this project. Do you think it's worth my time? Should I do something else? And I had this external, you know, uh, uh, mentor that could shed some light on what was, happening in front of me. And was I given the right opportunities for who I wanted to be, and things. And in the end, I called her at the end of my fellowship. This is just showing you, I mean, even coming to Stanford, for instance, shows you how first gen I was. I was in the middle of fellowship, and I was like, hey, so how do you get a job? I mean, this sounds ridiculous. This sounds so ridiculous when I say it now. But I remember saying to my fellowship director, like, so when do I apply? And it was December of my final year fellowship. And he was like, you haven't applied? And I'm like, well, you didn't tell me to apply. He's like, you just apply for jobs. I'm like, how do you do it? I, I've never had a job. I mean, that's how ridiculous. I was a trainee at Stanford. I still didn't know. I mean, it's just so ridiculous to think back on this. So I called her and I was like, I don't have a job. What do I do? She's like, just come work for me. So then I went to Northwestern, and I was her assistant program director. She'd become PD at Northwestern in the period of time I was her residency. And so it goes to show you that folks can come back around, and mentor you twice. So she hired me, and I eventually took her job as program director, and it set my career in medical education in the direction that it went. And I mean, I I mean, just so first Jenny, right? Is how I think about it. Like, how did I not even know how to get a job? So thank God she was around, right? I mean, just so many lifelines she gave me over the years. So she's been very, very important. So those two women probably been the most important mentors, in my early development. Yeah.
Thank you
Stanford
for
mentors
sharing.
too, who are listening, very important. But we can only have
Yeah,
so much time on today's vlog. But yeah.
of course, of course. I love that term first Jenny, like first gen
Yeah,
problems.
no, I do. I first Jenny a lot of my life. Yeah, it's like a cringy moment. I mean, it shouldn't be cringy. That's a bad word, but it does feel like, oh my God, I can't believe I just first gen that, right? Like,
Yeah, yeah.
so you try to help people along in
How do you
ways.
celebrate being first gen?
I don't know if do I celebrate it? I mean, I love telling the story about my fireman mom and my emergency medicine, or my fireman dad and my emergency medicine mom, and sort of the whole trajectory that comes from that. And I celebrate that. I'm so proud to have had a fireman dad. I mean, I just watched him and I idolized him as a little boy, right? I mean, he went into these burning buildings and came out with a person, and I mean, just was amazing. And I watched my mom it work, like resuscitate people. I mean, it was amazing, and they were heroes. So that was important to me, uh, and I celebrate that where I came from. I'm very lucky and proud of that stuff. So uh, I think when I retell that story over and over again, you weren't the first person to hear it. Yeah, I think I celebrate it every time I tell the story.
Is there anything else that you wish to share with our viewers?
Um, yeah, I continue to rub that seat that I sit in now, and I don't know if students would think that a senior faculty member with all the fancy titles I have and the things I do, right, still in a meeting will sit and rub his chair sometimes and think, how did I end up here? I mean, there's a great paper that I'm not going to be able to quote the title of right now, but maybe we can put it in the show notes for this. It's a set of axioms that a researcher wrote, and it's to folks considering a career in research. And I'll get you the paper for the show notes. But anyway, the first axiom is institutions don't love you back. I don't know if you've ever heard this axiom. And it makes me so sad because I love where I work. I really, really love it. And I would just wish that, that wasn't true because I can't imagine myself anywhere else. And I'm just super lucky that I ended up here. So if there's something I would want folks to know is that good fortune and gratitude doesn't go away for at least for me, but I would extrapolate that to a lot of first gen kids. Like I'm amazed that I'm here. I'm this kid from an upstate New York mill town that's long ago had its heyday, and there's no reason that I should be here. I mean, it's really, I mean, how did it happen? And um, I'm in the happiest place I could be. So I feel very, very fortunate to all the folks that helped me get here, and I still rub my chair all the time because it's surprising to me that you know I'm even on this interview with you. I mean, it's crazy to me. So yeah, so that's I guess my little secret is I still rub my chair.
Thank you for sharing your secret. So we have some rapid fire questions.
Oh, okay,
Um,
great. That's gonna be fun. All right, here we
yeah,
go.
yeah. You ready?
I'm ready.
What are you reading right now?
Reading tomorrow and tomorrow and tomorrow.
What's the last good movie you watched?
Uh, Inside Out 2 a couple weeks ago was very good because I have a teenage girl and who I took to Inside Out. Well, this is not rapid fire anymore. You're going to hear stories. So I took her to Inside Out 1 when she was a little girl. And, she's enjoying this cartoon. And as soon as it starts, dad's tears begin, right? And did you see it? There's Goofball Island and it might turn off and not to give it away, but, so anyway, it was tough. So then as soon as Inside Out 2 came, this is perfect, right? We have a whole new set of emotions. They're all around this house right now. And I love that movie. So there were more tears that occurred. But yeah, I love that movie.
Are you a coffee or tea person?
Coffee Black.
If you could live anywhere in the world, where would you live?
Palo Alto, California. Very close second would be Amsterdam, maybe Paris. That's probably three. I did do well in French in high school. I would say Amsterdam's two, but Palo Alto. I've got the best. I mean, if you want to live anywhere in the world, why don't you just go live there? He says very easily and casually, but I love where I live. If I lived somewhere else, I couldn't go to Stanford football games, and I'm a rabid Cardinal fan, so that would be terrible. So yeah, this is the best place.
It's fair. What
Fair.
podcast, if any, are you listening to right now?
Oh, Pod Save America. It's an election year. It has to be Pod Save America.
That's a good one.
It's a good one.
Are you a
Screw me
morning
up.
person? Oh, sorry, go ahead.
Oh, I was gonna say it's the for those who it's the old speech writers for Obama, and
hmm
they're a riot. Yeah,
They're hilarious. Are you a morning person or a night owl?
neither.
What's a song that always makes you happy when you hear it?
Mm, what's a song that always makes me happy when I hear it? Um, gosh, Counting Crows, Mr. Jones.
And lastly, what's the best piece of advice you've ever received?
Um, if you're gonna go into your boss's office with a problem, you should go in with a couple of potential solutions to offer. Otherwise, you're just whining.
It's good. Very good advice. Thank you, Mike. This has been an honor and pleasure. It was really great speaking with you.
This is really kind of you to invite me here. I'm super honored to be here, and thank you so much.
Thank you.